Sam Seder on the Majority Report. Emma Vigeland out today. It's a pleasure to welcome back to the program Jonathan Cohn, senior national correspondent, now at the Bulwark, author of Sick and the 10-Year War. That one about, about the Affordable Care Act. It seems like a million years ago. Jonathan, welcome back to the program.
It's nice to be here, Sam.
Over the past week, we have seen the agency director of the CDC sort of get fired and then resign, and then 4 of top officials at the CDC also resign. I think today, 1,000 workers at the CDC wrote a letter imploring the administration fire Robert Kennedy Jr. Let's talk about, one of the things that came out over the past week was that over the course of the past 9 months, approximately, that Kennedy has been head of Health and Human Services, he's never consulted with the CDC about anything.
Yeah.
It's insane.
It is. I think before, I think actually a good place to start, just as a general description of what is happening right now at the CDC, and frankly, not just the CDC, other agencies, but CDC, which is such an important, it's our command and control center for protecting our health. The way it's being treated, the way it is not being treated, the extent to which Robert F. Kennedy Jr., the most important health official in our country, has basically not consulting career staff, the experts there, on such a wide variety of issues is shocking. And the chaos we're now seeing there between the layoffs and the reorganization and the resignations and the firings, shocking. This is another universe from anything we've seen before. I've been doing this for a while. I'm a little gray in the beard here. I've covered Republican presidencies. I've covered Democratic presidencies. I covered the first Trump presidency. Nothing like this. This is completely dysfunctional government. And we have, almost feels like a rogue HHS secretary running around making policy because he thinks it's right, surrounding himself with yes people who will go along with it. And everybody with expertise, everybody who has background in this, left and right. And, when we're talking about the civil service, most of these people are not political. They're just career civil servants trying to serve their country and keep it healthy, being shut out of the process.
I was so shocked about this. And I will say that, full disclosure, and people know this, I hope, but I had worked with Kennedy on a radio program 10 years ago.
Right. That's right. I forgot about that.
There are people who are more disillusioned about him than but I know those people. So I'm in that, some of that universe. And it is one thing to say that he has these conspiracy theories in his head and preconceived notions of who's at the CDC and what their secret nefarious agendas are. But the idea that he didn't even bother to go and spend half an hour over the course of 9 months, an hour, even a couple of days, to make that assessment in person, just completely ignore this entire agency as if it doesn't exist, is mind-boggling. And this is an agency that is the product of over 100 years of essentially U.S. health policy.
Yeah, again, I've never seen anything like this. And, he has come in and he has this idea that the CDC is part of this deep state health bureaucracy, which of course is, it's similar and of a piece of the broader attitudes of the Trump administration, that people who are career officers in government they're at best not doing a lot of good, at worst they're actively undermining whatever the sort of best policy is. And his attitude has been to just sideline them and ignore them and get rid of them. And look, I've said from day one, I think there's every agency in government could work better. And if you want to talk about the CDC in particular, we can go back and relitigate what happened in COVID. And there's lots of room for criticism, lots of room for improvement. I don't think anybody would begrudge an HHS secretary from either party coming in and trying to shake things up a little bit. And certainly when you win an election and you get to, that's part of what you get to do, is you get to redefine an agency. But what I think is just so telling is there's a way you do that responsibly, right? I mean, and the first part of that is exactly like you just said, which is you get a feel for what's really going on, something you can't get from the outside. You get into office, meet with people, you study the problem, and then you put in place changes. Even if they're radical changes, you do it in a way so that you're not destroying all the institutional knowledge, all the capabilities. And that's what he has done. And we are at this shocking place right now. I know we keep using the word shocking, but it's I don't know what other word to use for it, where you can't trust the material coming out of CDC, because once upon a time you knew that it might be right or it might be wrong, like any judgment might be, but it was the process of a kind of considered judgment by people who actually knew their field, who were respected for their knowledge, their expertise. And that's just not true anymore. And it's just we've never been in a world like this.
And we're talking about career people, which is contrary to, Kennedy's whole thing was that there's a revolving door and there's this relationship between industry and the agencies that are unhealthy. And I would agree with that. I think we see that in a lot of sort of regulatory agencies. But it's generally the political appointees who are the biggest problem, or people who are leaving, not people who have been there for their entire careers and are continuing to do that. And so, all right, so who's doing what the CDC does? I mean, it seems like they're not allowed to sort of keep track of what's going on. They weren't consulted about the measles outbreak that was taking place. They could still be apparently in Texas, it is sort of burnt out, but we don't know what's happening in contiguous states. We don't know, because none of this stuff is now being, to the extent that it's being recorded by the CDC, they're not allowed to publicly report it, is my understanding. What else has he supplanted? And then I want to get to the vaccine, specifically in terms of vaccines, but what other functions are superseding, I guess, the CDC at this point?
So, I mean, it's hard to know, which is crazy to say. I mean, this is not how government normally works. We usually have some sense of how an agency works. We might not know at the detailed level of who's doing what, but there are offices and this is what they're doing. It's quite hard to know right now. This is not, this administration, again, not just HHS, not just CDC, the entire Trump administration. They don't put out memos saying this is they don't put out the reorganizational memos. They don't tell you what they're doing. What I know, first of all, is that we have a bunch of departments that have been eliminated or downsized dramatically. And that is as a result of that, even the parts of CDC that are kind of, you would think, on autopilot. So these are the things that maybe Kennedy doesn't care as much about, like helping cities and states with lead abatement, for example. These offices are so understaffed now, they can't respond quickly. And that's one of the most important roles that CDC plays, is as an advisor and kind of a big sibling to state public health agencies. State public health agencies, they're the ones on the ground frequently dealing with outbreaks when they first happen, or environmental toxins. You sort of go down the list, and they need expertise. They need manpower. Sometimes they need someone to just pick up the phone and sort of call on behalf of the federal government to make the wheels of bureaucracy or the private sector respond. And CDC, that's a really important role of CDC. Well, you can't get any of that done if there aren't people to pick up the phone or answer the emails. And that's what's happening at CDC right now, because they've been so decimated that they are just not responding. We saw this actually in the measles crisis early on. There was a story one of those stories that I thought would have gotten more attention. It was in, I want to say KFF Health News, about how the people in Texas during the outbreak were saying it was really hard to get responses out of CDC when they needed help, when they needed expertise, when they needed advice, when they needed the federal government to kind of be the heavy and make something happen. They just weren't getting calls back. And it seems like it was a combination of A, there weren't enough people because they've been downsized so much, and B, there was this hesitation because it touched on measles, because it touched on vaccines, because there were these orders telling CDC people not to communicate certain things in public. There was hesitation. What can we do? What can we not do? What will be allowed? And it's just mind-boggling. I mean, this isn't this shouldn't be a left-right issue. It shouldn't be a Democratic Republican issue. It's public health. It's keeping people from getting sick and dying. I mean, there's nothing political about that.
Hey, folks, don't forget to hit the subscribe button and check out our daily show. We do it every day at 12 p.m. Eastern for about 2.5 hours. We even take phone calls. You should check that out.